bipolar, as the word suggests, there are bi, as in two polar opposite on a linear scale. If we can take an example, on a linear scale, it is two polar opposites. One is extreme happiness and one is extreme sadness. So bipolar is something where this both symptoms are seen. Like they have episodes where sometimes the person is extremely happy, or they have episodes where the person is extremely sad. So when the person is extremely sad, we call it depression. When the person is extremely happy, they become very aggressive, very energetic, they don't sleep at night, we call it mania. So when these two are together, we say that it is a bipolar disorder. And how it is different from mood swings is, when a person has mood swings, he can still work. If a person is having a mood swing where they are very frustrated and they are getting angry on everybody, they won't just act on it impulsively. They are going to think about it. They are going to understand, okay, I am feeling frustrated, and then act on it. But a person with bipolar has a tendency to get involved in very risky, impulsive behaviors, where they won't really think about what they are doing. They would just do it. So bipolar is a mood disorder that affects an individual, where you can see the extreme mood changes in a person, and usually these mood changes can be affected by their environment. Sometimes it can be genetic, sometimes it can have other reasons as well. Usually when people go through bipolar, they are misunderstood as, he's having anger issues, or he's extremely happy, jolly. But actually the issue is that they are actually suffering from a disorder, and they almost have no control over their emotions when they are going through the bipolar disorder. When we talk about bipolar mood, there are two major symptoms that we talk about in bipolar. One is mania, one is depression. Okay, so mania is when a person's mood goes into extreme happiness, or anger, or irritability. When the person gets extremely energetic and they can't sleep, they tend to involve into risky behaviors, regardless of not thinking about it. And while this is one extreme, the other extreme comes when the person goes through low mood, extremely low mood. With low mood, they also suffer from fatigue, and then they also have this loss of interest in all the things that they used to do. Basically, they become so tired that they are not able to do simple tasks that they would do very easily in a normal day. So that way, bipolar affects mood where there are extreme symptoms present. So usually emotional instability also has it is also attached to the events happening around them. For example, somebody has died, so a person is going to be sad, and sometimes that can change into anger in just few seconds. That is also change of emotion. But in bipolar, that does not happen. If a person is extremely happy, they are not going to listen to anybody else who are telling them, okay, why are you happy in this situation? They are just going to be happy. They are just going to be energetic. So it is different in a way where emotional instability a normal person can also face. But when it comes to bipolar, it is not just emotional instability. It is a lot more than that. So the happiness in bipolar, that when you see a person, usually we have emotions related to the situation that are happening around us. For example, something good happened, so we become very happy. Something bad happened, we become sad. But when a person is going through mania, they are not going to see what is happening, what is good, what is bad. They are just going to be happy. That's a general thing, that they are just going to be very happy. Even if the person they love has died, they are going to show happiness. So when this extreme happiness comes in without any context of the events happening around them, we can consider that, okay, this person is going through something right now. So there is very high energy. The person, very common symptom of mania is the person will not get sleep at all. They will be awake the whole night. Then another one is impulsive act. They are going to act very impulsively in any situation. Impulsively and risky. They will not consider the risk that can come after acting on it. They are just going to act on it. So when a person is normally sad, they are not going to stop working. They are going to be sad, they are going to feel low, and then they will start working because that is how life goes on. They are going to understand that. But when we talk about depression in bipolar, it is going to be sadness where they are not able to work at all. Like their daily functioning is going to be affected. Their hygiene is also going to be affected. Also, loss of interest can be seen, and they are not able to get out of bed because they are not interested in doing anything, or because they are so tired to do anything at all. So this way it is a bit different from the general sadness that we feel. So I will talk about three symptoms here. One is mania, hypomania, and depression. So what mania is extreme level of happiness, extreme level of energy, extreme level of aggression, irritation, frustration. They involve in risky behaviors, impulsive act is happening. The person is not ready to listen to any. Even their self-confidence is very high when they are in mania. They will talk like, I can do anything I want. And when a person talks like that, when a person emotion are not related to the events happening around there, you can seek help at that time. At the same time, hypomania. So hypomania is a mild level of mania where person is going to face those symptoms, but those are going to be mild. But if you know the person, you will understand that, oh, there is some difference here. Like they won't be extremely happy, but they are going to be happy in a situation where nobody else is going to be happy normally. And third one is depression. Depression is when a person is feeling extremely low, or when they are feeling fatigued, they are not able to work, they are too tired to even take care of themselves. Their self-hygiene is affected. So that way, these are few of the common symptoms that we tend to look into when a person comes to us with bipolar in question. What generally happens is everybody faces mood swings, right? And sometimes it can be a little bit extreme where they face mood swings. They'll go on Google and search, okay, I'm facing mood swings, what do I do? The Google is going to give a long explanation of all the things that are related to mood swings. Now, a person, it depends actually on a person. Usually they tend to get attracted to the most bigger issue that is there. Like, for example, bipolar. They might not be having bipolar, but because they have mood swings and they went on Google, they got a result that, oh, bipolar, I'm having bipolar. So that is going to affect them. Now, who are the correct person to contact if you feel like that? Try contacting a psychiatrist and a clinical psychologist. These two are the registered people who can actually diagnose you. Other people can tell you that you have this or you don't have this, but they are not really qualified to give you a diagnosis. So it is same as when you go to a doctor and you go to a person who claims to be a doctor. So you are not going to take a medicine from a person who just claims that he is a doctor. You are also going to look into them as, what have they studied? Are they actually the person who I can seek help from? So this is also very important when you have any psychiatric illness or any psychological disorder, that you go to the correct person rather than just randomly going to life coaches or mind readers or all those other people. There are 4 types of bipolar that I can talk about today. One is bipolar 1, one is bipolar 2, one is cyclothymia, and one is rapid cycling. So bipolar 1 is where symptoms are of extreme, like extreme mania, extreme depression. Bipolar 2 is when there is hypomania and extreme depression. And cyclothymia is, so usually cyclothymia lasts for 2 years and it is persistent. So a person will have subtle low mood, subtle hypomania symptoms that becomes difficult for somebody out of this profession to, diagnose. And the fourth one is rapid cycling. So in rapid cycling, the mood changes so fast that people can get confused. Like, okay, what is wrong with this person? Like, one day he's very happy, another day he's extremely sad, one day he's not sleeping, other days he's sleeping a lot. So these are few common types of bipolar that we use to diagnose. Bipolar is something that has a lot of misconceptions because of its variety of symptoms. So, few of the misconceptions to name. First one I would say is mood swings. People assume that the person is going through just mood swings and that is why he's behaving the way he is. But it is not just that. Another thing is, as I have mentioned before, bipolar includes extreme moods. So, in that extreme mood, one of that is extreme happiness. So people assume that the person is happy, that is a good thing, but extreme happiness is also a symptom. Another thing is emotional instability. People also believe that the person going through bipolar is emotionally unstable. He's not able to handle his emotions. But no, that is not true. The person is helpless in this situation actually, where they are not able to handle their emotions very well. Another one is they get involved in risky behavior, and which is why people assume that they are just mischievous or naughty. But no, if a person does not regularly have that kind of behavior, when that behavior changes, it means that they are going through something and it is regarded as a symptom. But no, if the person was just acting, they wouldn't go through so much difficulty just to act. So yeah, these are a few of the misconceptions that are assumed by people. First of all, a person, if your loved one is suffering from bipolar, try to understand what bipolar is. First of all, that is very important. When you try to understand, you will understand that this happens because there is a trigger somewhere. Try to understand that trigger, and if possible, try to avoid that trigger if possible. Sometimes it is not possible, and that is okay. Another thing that they can take care of is try supporting the person. I'm not saying support them when they are going through a manic episode and they are into risky behavior and you go and give them more bat and squash everything. No. But try to understand that they are also going through a difficult time and they are actually not aware of what they are doing. They are not very conscious of the decisions they are making. So try to understand that. Another thing is, whenever you have any questions regarding this, whenever you have any queries or you want to know more about, contact the doctor. Try maintaining their schedule of medications that they take. Medication is extremely important when it comes to bipolar because the mood can be affected if the medicines are not taken properly. Other thing that they can do is actually find support groups for the people that are suffering from bipolar, so that they don't have to take the whole responsibility, because it can be too much for a caretaker to take the whole responsibility of a person. When they find a support group, the person also has somewhere outside where they can talk about it, and that time the caretaker can also take care of themselves, because if you are not going to take care of yourself, you will not be able to take care of anybody else. So I think these are few of the points that a person can keep in mind when they want to support somebody with bipolar. So bipolar affects all the aspects of your life. It's not just relationship or it's not just your workplace. It affects all the areas in your life. How it affects relationship is, I'll give you an example. If a person has bipolar, he's going through mania right now, he is going to, maybe he has a symptom where he spends a lot of money. Now, a person spending a lot of money affects the family, because, well, if they are married, then they must have had plans, but this person is just keep on spending. So that can affect the relationship in a way where the wife would think, oh, he's so selfish, he's just spending the money on himself. Another example that I could give is a person can get paranoid when going through mania stage. So if a person gets paranoid, if a person gets jealous and starts doubting their partner, this is a very common thing. The partner is not going to just sit there and listen to whatever the person is saying. They need to understand why that is happening. And because it is not diagnosed, the person keeps on doing that and it goes to extreme. And that is how it affects the relationship very badly. Like, who is going to sit there and listen, oh, you have cheated on me, you have cheated with that person or that person. So that is one of the reason how it, like, one of the way how it affects the relationship. Also, sometimes when the person is going to a depressive episode, they tend to get aloof. They don't talk to the person, and the other partner does not understand why the person is not talking to me. So that way also it is affected. Their relationship is affected in a way where they feel like, oh, okay, I'm just not important to them, so they just decide to split. But rather than understanding that no, the person is actually going through something. Also, after knowing that they are going through something, also these cases can happen, because not everybody can understand. We cannot expect everybody to understand that the person is going through something. So that is how generally it is, the relationships are affected. Now, it's not just relationships, it is also their workplace that is affected, because the person will not be able to work as well as they can in a normal situation. When they are going through an episode, for example, if they are going through mania, if somebody says something during their working hours, they are going to get so angry and make a big deal out of that the another person is not going to understand that the person has bipolar and is doing that because of it. He's just going to assume that the person is just getting angry on me, and he might get fired because of that. Also, there are issues with aggression, there are issues with irritation. All this happens and it can affect everybody. Like, let's assume that your partner is very supportive and very empathetic with you, that okay, you are going through something and that is why you are behaving like that. But what about the world? The world is not going to understand that. The world does not know what it is. So in that way, yes, it affects almost all the areas of your life. So, bipolar is not something that we can say that, oh, this is only because of this thing. It is a combination of a lot of things happening together and then ending up being a disorder. For example, there could be genetic involvement where, there is a past history of psychiatric illness in the family that could affect a person. Then there could be a vulnerable situation around the person with genetic involvement that could have a different effect on the person. Also, in bipolar, research has shown that there is abnormal activity in the chemicals in the brain. So neurotransmitters, imbalance in the chemicals of brain that we usually call neurotransmitters. These neurotransmitters can include serotonin, noradrenaline, and dopamine, to name a few. So when there is imbalance in these neurotransmitters, the mood is affected. And basically bipolar is a mood disorder. So that way even those can be considered. But if you ask me, name just one thing that can affect bipolar, there is no one thing that can affect bipolar. There is your vulnerability inside body, that is your genes, your vulnerability in the environment where some events happen that has affected you pretty badly, and there is also vulnerability in your brain chemistry where there is imbalance in the chemicals that play major role with mood. First of all, we'll discuss when to approach for help. So whenever you feel that you are facing some difficulties in handling your mood, or you feel like you are not understanding what kind of mood you are going through, approach a person. Just go for to a psychiatrist or a clinical psychologist. please make sure that you go to a psychiatrist or a clinical psychologist, because they are the right person to diagnose you. Other people cannot diagnose you, and they are not licensed to do so. When you approach a psychiatrist, they are going to prescribe you medications that could include mood stabilizers and medication, sometimes anti-psychotics as well, depending on your symptoms. With that, when you approach a clinical psychologist, they are going to help you through therapy. So how can they help you? First of all, they can help you figuring out your trigger. Why did it happen to you specifically? Because it is different in all the people. Like every person who is going through bipolar is not going to have a same trigger as everybody else. So first of all, understand what is bipolar. Second, try understanding your trigger, so that when it happens next time, you understand that, okay, this is starting now, like this is something is odd in me, and that way it might help you prevent it. Another thing that you can do is, so when a person comes to us, we start with supportive therapy, where we listen to you a lot and we just support you by sitting there. After that, we will decide what therapy suits you the best. So sometimes some people can approach cognitive therapy, some people can approach some other types of therapy, depending on the specific situation that the person is going through. So one of the approach is cognitive CBT, cognitive behavioral therapy. Another one is main focus should be on emotion regulation, because as we see that there is instability in mood. So a person might need a little help with emotion regularity. So they can go for DBT. DBT has a very good model for emotion regulation. They can go for mindfulness as well, where they become aware of the situation, and that will also help them understanding the trigger. As you become aware of the situation, you start understanding what is happening in the present, rather than being lost and being confused about what is happening. So these are few of the therapies that a person can go to. So alternative therapy, there's a reason why it is called alternative and it is not called main therapies, because you can do it with the therapy that you are going with, the medications that you are taking, and with the therapy that you are taking, like CBT or mindfulness or DBT, whatever. But you cannot just depend on them. Exercise is very good, agreed. But if you are in a manic episode and you go and do your yoga, it is not going to help you get out of manic episode. You will have to take medications for that. You will have to deal with your emotions to, avoid it next time. Yoga is not going to do that. Yes, yoga is a very good practice. It can help you in managing emotions, but that is not, you cannot just do yoga and think that, oh, now I will not go through any episodes. No, that does not work like that. So similarly, different practices are there. There are a lot of practices that are happening outside. I'll give you a simple example. You go to a doctor for medication and you go to a chemist for medication. A chemist is going to listen to your symptoms and he might give you medication, but you don't know, like the chemist doesn't know as well as your doctor how good the medication is for you. Your particular case, your doctor knows. So they are able to provide you medication. If you go to a chemist, he is just going to give you a general medication. So these alternative therapies are like general medication for you. So first of all, I would like to say that please do not take this very lightly. This is a very serious illness and it needs to be treated, and it needs to be treated by the correct people. It just cannot be treated by anybody who is working in mental health profession. No, it has to be a clinical psychologist and a psychiatrist, and they will also treat it together. It's not just that if you go to a psychiatrist and it will resolve everything. No, you have to get therapy as well. So try to go to the right person for this. You might find a lot of people who might say that, oh no, we can also handle this case. But no counseling psychologist, no psychiatrist, social worker, no yoga instructor, no life coach or mind coach or anybody of that sort is going to go help you handle that situation. You will have to come to the right person, and only then will your treatment work for you. Otherwise, the symptoms might just worsen, and you might just lose the confidence in people. Like you will feel like nobody is able to help you and your condition is that bad. No, actually, we are trained to do that for you, but for that you will have to come to us rather than going to other people. How do you know? Clinical psychologists have RCI license and psychiatrists also have their license. So it is completely okay for you to ask them, okay, do you have a license or do you not have a license? If they don't have a license, change your psychologist or therapist, whoever that is. Only when they have a license are they legally allowed to treat you. Please keep this in mind. Okay, the last point is, we are here to help you. We are willing to help you, and we will try our best to help you as much as we can. We here at Mibo have coffee talk approach that we use, so that the client that comes in does not feel very uncomfortable with with sharing all the things that they need to share. It is a very stigma free place, so you can feel free to come here and ask for our help. We are always ready to help you.